Animal health risk analysis is a methodology and a process that include three main components: risk assessment, risk management, and risk communication. Risk assessment is the evaluation of risk. Risk management is the process in which control measures are implemented to reduce the level of risk. And risk communication is the way that stakeholders and decision makers are sharing information during the process of the risk analysis. If we are using, for instance, vaccination or other control measures, these efforts can be focused or targeting the areas with high risk. And this will allow us to use more efficiently the resources that are limited in some developing countries for disease control and prevention. The practical application of risk analysis in the prevention and control of animal diseases. When we have outbreaks of animal diseases, one of the first steps is to assess the risk of further spread of the disease moving to other areas or locations. I think doing a risk assessment at that time can help the decision makers, the veterinary services, to have a more clear idea what are the risks and the areas that can be more exposed to these hazards. Risk analysis is very important because it's a tool that supports decision makers to have better decisions related to the import and export of animals, but also because this tool can be useful to support the management and the plans to prevent and control animal diseases at national level. National agencies related with animal health or food safety issues should be the implementers of the risk analysis methodologies and work, but this should be in close collaboration with all stakeholders along the livestock sector, which include farmers, private sectors, and livestock communities. Any agent that can produce an adverse consequence on human or animal health can be considered a hazard. This could be a biological, chemical, or physical hazard. One example is an animal pathogen. Risk, on the other hand, is the likelihood or the probability that a hazard occurs in a specific population in a specific period of time, producing some consequence in terms of production or some economic impact. FAO promotes the use of risk analysis to improve the decision-making process by veterinary services, in particular how they plan the prevention and control of animal diseases, which are priorities for those veterinary services. And how FAO is doing this is promoting best practices, developing guidelines, and also providing training to veterinary services and animal health technicians on the use of risk analysis as a tool to support disease prevention and control.